I'm guessing what you're referring to there isn't the conformist then on the NHS. Is that right? Conformist?
No, the conformist is an implant, which, I mean, it's not a huge amount more expensive than a standard knee replacement off the shelf in the NHS. The CT scan that you have to spend money on before the surgery, plus the added expense of the manufacturing of the cutting jigs, means that within the NHS, it's just not economically viable, I don't think. Yeah. When you start looking at volume, if you're talking about the occasional patient who maybe should have this sort of implant, there's if you can come up with a good reason to justify an added expense for the occasional patient, but if you say, well, we're going to do conformist for every patient in the NHS, the bill would be, unrealistic.
Unrealistic to the outcome. Yeah. Are you able to give us the name of the one that you do as standard on routine on the NHS?
At NHS, I use something called the Next Gen, which is an implant made by Zimmer. It's one of the biggest, sellers worldwide in knee replacement surgery. It has excellent outcome data on the National Joint Registry for a standard off-the-shelf knee replacement. It offers me a lot of options for variability to help me with that task of trying to match sizing to the particular patient. Unlike other designs of knee replacements, the Next Gen implant that we have off the shelf comes in not only different sizes but also different widths. You can select a narrower width implant or a wider width implant for a particular patient. It also has different options to help with range of movement. It has something called a high flex alternative version, which for some patients may well improve range of movement after surgery. So the inventory, the number of implants that I have on the shelf in theatre is a bit bigger with Next Gen compared to competitor designs, but I can find that quite useful for managing my patients, intraoperatively, where I'm in a situation where I'm trying to get the best fit to improve outcomes, hopefully.
Amazing. So is that literally the case? You have more lined up on the shelf, and it's like, I'll go that one, that one, that one, that one.
It's not actually in theatre. They have shelving in the storage area, right. And so when you do a knee replacement, once you've opened up the knee and done the resection of the bone margins, you've measured what size implants, then there's a runner who you instruct what particular sizes of implants you're going to require, and they get brought in, sterile, packed in a box. There's a lot of care taken to make sure that we implant the correct implant for the correct patient. So there are timeouts during the surgery where we stop and all focus on making sure that what we're going to implant into the patient is what we need to get the best outcome for the patient.
Yeah, got it. A bit like, I suppose it sounds a bit like going down to your local shoe store and say, bring me up a size 7, please.
Yeah, 7G, I think. 7G.
7G, yeah, exactly. No, a bit more technical than that, but no, that's excellent, fascinating. Well,